Good morning, Nashville. How is everyone doing? Well, I am absolutely delighted to join you this morning here in Nashville for what I know is going to be an absolutely terrific conference. It is 8:30-ish in the morning, though, and I know that it is an early awakening for many of us, particularly with just 1 week out from daylight savings change and the morning after what I hope was a fun-filled St. Patrick's Day for all of you. So what better way to kick things off than with a fun quiz?
All you have to do is click the button below and answer a few questions. These will only be given out until the end of the day today, so don't hesitate. Supplies are running out, so get yours while you can.
Is the microphone working? Okay. So what you just saw was a Taylor Swift video, and the game that we're going to play is this real or is it fake? What do we think? Is this a real video or a fake video? One more time. Real or fake? Excellent. We've got some smart people here who can recognize that this is a deep fake video of Taylor Swift. She is no more selling Le Creuset cookware than I am here today to sing country music videos. And I assure you, it's country music songs. I assure you, I'm not going to do that to you this early in the morning. So let's do one more. This isn't a video, it's just a shot. What do we think? Is this George Clooney selling Nespresso? Real or fake? It is real. Mr. Clooney has spent quite a bit of time overseas drinking fancy coffee, and he's brought this back for us all to enjoy. And let's do another. Is this Oprah Winfrey selling weight loss gummies? Real or fake? You're good. This is indeed fake. One last one. Tom Hanks, is he selling dental services? Real or fake? No one knows. Real or fake? One more time. Fake. It is fake. The deepfake videos like these are seen millions of times. And from a technology perspective, deepfakes are fascinating, and they are also deeply worrisome. Technology has delivered us to a place where something that appears to be entirely real is often fake and undetectable to the public. Deepfakes are the epitome of what you see is not always what you get. You cannot trust what your eyes and your ears are telling you. In fact, in a world where deepfakes are possible, we must learn when to disbelieve what we see and what we hear. To avoid being fooled, we're called upon to sharpen our skepticism, to amplify doubt, and to ask more questions. It's harder to trust, and it's harder to earn trust. And the topic I want to reflect on with you this morning is cultivating trust. How building and valuing trust with diverse stakeholders can help Medicare Advantage, managed care plans, and their business partners weather headwinds and more safely navigate choppy waters. All too often, managed care is under the government and public microscope. Since this conference last year, scrutiny of managed care business practices and the enrollee experience has only intensified. All too often, there are critical gaps between the attractive promise of managed care to deliver cost-effective, high-quality care and care that is coordinated and how it operates in practice. We see this in important areas like prior authorization and risk adjustment. And these gaps, if not closed, pose real risk, not just to patients, but also to managed care plans and the Medicare Advantage program. If Medicare Advantage plans and their partners cannot turn promises into reality, then it begs the question of whether managed care was a mirage in the first place. And plans risk eroding hard-to-earn trust of important stakeholders like consumers, providers, regulators, policymakers, and investors. So I'm not going to sell you cookware here today, but I do hope to sell you on this idea. Managed care leaders must devote more attention to cultivating trust. There are stacks of books and articles on the topic of trust. Philosophers going back to the ancients have pondered trust, what it is, how one obtains it, and how it is lost. Business schools teach the art and the science of trust. These sources point to important values that enhance trust, such as reliability, transparency, and accountability. Common images about trust are telling: a handshake, a toddler leaping off the pool deck into his parents' arms, rock climbers pulling each other up the sheer face of a cliff. These images remind us that trust speaks to strong bonds between people, and what people perceive as trustworthy changes over time. Take bank architecture. Architects design banks to convey security, confidence, trust. Historically, bank buildings were imposing, solid, often with grand columns. These edifices proclaimed, "Your money is safe here." You could walk around almost any city or town and pick out the banks from their facades. Back in the day, if you were traveling in an unfamiliar town, even if you didn't speak the language, you knew where to pop in to cash your traveler's checks, just by the look of the buildings. So cashing traveler's checks, do we remember those? The buildings, the Roman centurion, you see here on the traveler's checks, they all project safety. Even after those Wild West bank robberies stopped being grab and runs, bank design favored architectural style that reassured people that their money was safe. Over time, bank design became sleeker, more transparent, with lots of glass, expansive open spaces, and fewer bars on teller windows. Architects designed banks to project a contemporary image of trust, that banks are modern enterprises with modern methods of safeguarding funds and serving customers. These edifices also claim you can trust us with your money. Like banks, managed care plans must be trusted to handle what people value greatly: their health and their well-being. One way for managed care organizations to cultivate trust is through compliance. Acting and being seen to act with integrity is a concrete means of fortifying trust and projecting trustworthiness. One way for managed care organizations to cultivate trust is through compliance. Acting and being seen to act with integrity is a concrete means of fortifying trust and projecting trustworthiness. An organizational culture of compliance and an effective compliance program do sound like, I acknowledge, a lot of corporate legal jargon. But compliance is fundamentally about trust. It's an organization being committed to doing the right thing, to fixing what has gone wrong, and to meeting the needs of its stakeholders. Compliance with the rules of the road signals being trustworthy matters to us. I hope to persuade you to seize important opportunities to create business value and reduce reputational risk by bolstering compliance with Medicare rules. You can act to close gaps between the promise of managed care and the reality that it sometimes underdelivers on its promise. And this morning, I'm going to offer a few specific examples from OIG's work of known gaps and opportunities for managed care leaders to take meaningful action. I'll describe steps OIG is taking to help strengthen managed care. Last year at this conference in Colorado, I urged managed care leaders and plans to intensify focus on program integrity, risk, and compliance. And I've returned this year to underscore my steadfast commitment to ensuring that the Medicare Advantage program delivers cost-effective, high-quality care to the millions of enrollees who rely upon it. And this is one of my top priorities as Inspector General. From its inception, managed care presented an attractive alternative to fragmented fee-for-service, volume-driven healthcare. The vision was for well-coordinated healthcare that enhances patient outcomes and lowers costs. Managed care gave seniors and people with disabilities more choices for coverage. Managed care could shift risk to plans, which could harness the know-how, technology, and business acumen of the private sector. Plans would also then be able to keep reasonable profits. Policymakers saw capitated payments as a driver to reduce wasteful spending, with risk adjustment as a backstop to ensure that high-cost patients would not bankrupt plans. Managed care enrollees would receive high-quality, medically necessary care ordered by their doctors and have a better experience because their health care would be coordinated. Enrollees would also benefit from lower out-of-pocket costs and supplemental benefits in exchange for using a prescribed provider network and being subject to cost containment mechanisms like prior authorization and formularies. Managed care, I don't mind saying it, it possesses tremendous curb appeal, but only if it can deliver on its promised outcomes. Unfortunately, in some important ways, Medicare Advantage is falling short of its vision. You know better than I the headwinds blowing at managed care. Plans are drawing increased scrutiny from Congress and regulators for problematic risk adjustment and prior authorization practices, including the use of artificial intelligence. CMS is tightening regulations to compel improvements in plan operations, and the number of fraud prosecutions is up. Stories about consumer dissatisfaction with Medicare Advantage abound, and gains in Medicare Advantage enrollment may be slowing. While many Medicare Advantage enrollees are satisfied with their plans, chatter around the senior water cooler, or more likely the decaffeinated tea urn, is that Medicare Advantage plans deny medically necessary care, make patients jump through unnecessary hoops, and put profits over patients. Some patients are walking into their doctor's waiting rooms and finding warning signs about enrolling in Medicare Advantage. Prospective enrollees study the marketing materials in the network directories, but their experience after enrollment often diverges from what those materials promise. The message some are conveying to their peers: steer clear of Medicare Advantage. And that surely is not the word of mouth that you're looking for. Meanwhile, cybersecurity attacks and disruptions threaten plan operations. A growing number of hospitals, health systems, and medical groups are voting with their feet and terminating contracts with Medicare Advantage plans. For some managed care companies, unexpected utilization patterns have thrown off financial forecasts, raising questions for investors. And some experts and longtime advocates for managed care have become so disillusioned that they express readiness to throw in the towel. Which brings me back to that topic of trust. When faced with strong headwinds, trust can be the tailwind that helps a business stay the course. As the saying goes, trust is hard to earn and easy to lose. Trust is fragile, and it's also immensely powerful. Trust is any OIG's coin of the realm. Department officials, Congress, the healthcare industry, and the public expect OIG to produce independent oversight and enforcement that is data-driven, that is objective, that is transparent, and that is impartial. Our stakeholders expect us to adhere rigorously to widely accepted professional standards. They listen to us because they trust us, even if they don't agree with us. We also own our mistakes, and we do make mistakes. If we get it wrong, we make the correction, and we're seen to make the correction, and that matters too. What I know and what I convey to my team, the 1,600 strong at HHS OIG, is that we can only be successful in carrying out our mission to protect the over 100 programs and the beneficiaries that they serve if we and our work are trusted. Myriad cautionary tales come to mind of catastrophic business consequences when trust breaks down. We recently excluded Elizabeth Holmes, founder and former CEO of the biotech startup Theranos, for a period of 90 years. OIG's authority to exclude people and entities from participating in federal healthcare programs exists precisely to ensure that those who are untrustworthy cannot treat federal healthcare program enrollees. I suspect this audience is very familiar with the Theranos story, and I won't repeat the details here, but it bears pausing for a moment to notice the breakdowns in trust played a chief role in Theranos' downfall. The company's blood testing technology delivered inaccurate and sometimes dangerous test results, and this truth was concealed from consumers and from providers. Investors, induced to provide millions in funding by Ms. Holmes' false claims, lost confidence and suffered financial losses. And misleading claims about Theranos' product grew, of course, government scrutiny. Theranos had lost the trust that it had been given, and Theranos' conduct had ripple effects and increased skepticism of investors, consumers, regulators, and others, and about future claims of bold innovation. And future innovators are probably going to have to make up some of that ground. Trust matters. It's more than just a branding exercise. It requires commitment, persistence, and leadership to do the right thing. Medicare Advantage cannot live up to its promise through government action alone. Plans, too, must act. Persistent underperformance in meeting goals and requirements of the Medicare Advantage program pose risks to business success and reputation. And if underperformance veers into misconduct, the risks become even greater. So, what should managed care leaders do? Championing an ethical corporate culture that values and practices compliance is an excellent starting point. Across the healthcare industry, we've seen great strides in compliance that are possible when there is will and leadership commitment. I'll offer 3 examples of concerning shortfalls in Medicare managed care that jeopardize trust and present clear opportunities for managed care leaders to make improvements. First, let's take a look at prior authorization. Said plainly, prior authorization is not working the way that it's intended. Our work has revealed basic breakdowns in prior authorization processes, resulting in improper denials of Medicare-covered services. In a review of Medicare Advantage plans, we found that more than 10% of prior authorization denials were for care requests that did, in fact, meet Medicare coverage rules. For instance, a plan denied a request for a CAT scan that was medically necessary to rule out a life-threatening aneurysm. The managed care plan denied the request because the patient did not have an X-ray first. Medicare, however, has no such requirement. I think about being this patient and this patient's family, how infuriating it would be, how little trust I would have in my insurer and a health system in which this could happen, and how scared I would be to have my care for a life-threatening condition delayed. When prior authorization misfires in this way, it risks being perceived as unfair, unreliable, and a crass mechanism to stint on patient care to goose up profits. The laudable purpose of prior authorization to curb genuinely wasteful spending and low-value services so that plans can appropriately manage risk and lower costs is lost. Plans can do better, and the ball is in your court. We've seen positive movements among plans. Several large managed care organizations announced that they have eliminated certain prior authorization requirements, in some cases reducing requirements for up to 20% of services. CMS has promulgated new rules to improve prior authorization, and ensuring compliance with these new rules should be a priority. If done right, prior authorization can be an important tool for risk-based plans to manage spending on healthcare and lower healthcare costs. If done right, enrollees will get timely, medically necessary care that is covered by Medicare. If plans improve prior authorization practices, plans will earn more trust from consumers, providers, and government programs. Next, risk adjustment. The gap between how risk adjustment should operate and how it currently operates seems to be widening and at a considerable cost to Medicare and federal taxpayers. Paying plans more to care for people with serious medical needs makes sense and preserves and expands access. Our work shows, however, that plans often submit claims based on potentially inaccurate diagnoses. In some cases, we see purposeful upcoding to obtain higher risk adjustment payments. Our audits, HHS OIG audits, show that plans are consistently receiving substantial risk adjustment overpayments. CMS, GAO, MedPAC, and others have identified similar patterns, amplifying concern about the integrity of risk adjustment payments. Given this, the uptick in enforcement actions related to risk adjustment is not surprising. For instance, in a well-publicized case, the Cigna Group agreed to pay $172 million to resolve allegations that it violated the False Claims Act by, among other things, submitting false diagnosis codes in order to increase its payments from Medicare. In another example, the former director of Medicare Risk Adjustment Analytics at HealthSun Health Plans was charged with orchestrating a multi-million-dollar scheme to submit false and fraudulent information about chronic ailments that plan enrollees did not actually have. An alleged motivation, increasing company profits, and the director's own compensation. Of interest to this audience, the Department of Justice declined prosecution of the company, and I think it's instructive to look at why. DOJ considered factors such as the company's prompt voluntary self-disclosure, its cooperation, and its steps toward remediation. HealthSun agreed to repay about $53 million in overpayments. And where's that former director now? They're awaiting federal criminal trial. Unless plans do more to prevent fraud, upcoding, and erroneous diagnosis codes for risk adjustment, plans can fully expect oversight, regulation, and enforcement. Plans have an opportunity and a responsibility to implement better processes and practices so that risk adjustment does what it was meant to do: compensate for legitimate costs of treating sicker patients. A concrete step managed care plans can take is to use the methodology from OIG's risk adjustment audits to pinpoint problems in your own data. In December, we published a toolkit to help plans do just that. The toolkit is meant to be a practical springboard for plans to initiate measures to prevent, to detect, and to correct errors. Next, let's take a look at fraud being committed against plans. Fraudsters are stealing money from Medicare Advantage plans. While many honest vendors serve Medicare Advantage plans and enrollees, fraud committed by providers, suppliers, and others against plans is pervasive. Just as we're committed to ensuring that Medicare Advantage plans follow the rules, we are equally committed to ensuring that Medicare Advantage plans and enrollees are not victims of fraud. We know from experience that fraudsters pay close attention to industry trends and, most importantly, to where the money is. Medicare Advantage managed care is where the money is, and fraudsters follow the money. One area worth paying attention to is fraud by durable medical equipment suppliers. DME fraud includes everything from use of stolen billing numbers to billing for unnecessary phantom supplies to kickbacks. Increasingly, DME fraud is perpetuated on a national scale using sophisticated technology like telemedicine platforms and aggressive marketing software. While DME fraud has been a long-standing problem in traditional Medicare, we have seen DME fraud schemes migrate to Medicare Advantage. Again, Medicare Advantage is where the money is. We're seeing large increases in DME billing in Medicare Advantage, and these increases are cause for concern. If the increases result from fraud, both plans and the Medicare Advantage program are harmed. Here's one example. Operation Brace Yourself was a major law enforcement operation that shut down a $1 billion medical brace scheme in traditional Medicare. When that fraud was shut down, we saw a nearly instantaneous migration of claims for orthotic braces to managed care. Within weeks, traditional Medicare claims for the braces dropped by 9%, but claims for the same types of braces billed to Medicare Advantage increased by 22%. In one case, our enforcement shut down fraud by a DME supplier billing Medicare Part B for orthotic braces. The fraudster opened a new company at the same address and started billing Medicare Advantage plans instead. The criminals switched tactics to target plans. Evidently, they perceived less risk of being detected. When one door shut, the criminals looked for another, less well-guarded door. One emerging risk area involves DME suppliers that do not participate in traditional Medicare. There are thousands of DME suppliers that only bill Medicare Advantage. While there's not a requirement that DME suppliers enroll in traditional Medicare, the lack of enrollment means that these suppliers have not been vetted through Medicare's enrollment screening process. Thus, as plans contract with DME suppliers, it's worth asking very fundamental questions. Do you know with whom you are doing business? Do you have policies and procedures in place to screen for risky suppliers? Fraud schemes orchestrated by DME suppliers can be difficult for plans to detect, and this is because individual plans have visibility only into a slice of the overall fraud scheme, the part that's being billed to them. And this is where public-private partnership can make a significant difference. Our Office of Investigations is working closely with plans and other law enforcement partners to detect and stop fraud. Unlike individual plans, we can better see the full picture, including billings to multiple plans. And I'm pleased to report that collaboration launched last year between special investigative units at managed care plans and OIG's investigators has gained traction. Plans are stepping up their engagement with healthcare fraud working groups, and as a result, we're seeing an increase in fraud referrals from managed care plans. I commend you and your plans for these important efforts to help us help you, and we can continue to help. OIG has a proven track record of success in finding and stopping DME and other forms of traditional fraud in traditional Medicare. With collaboration from plans, we can be similarly successful in curbing fraud that harms Medicare Advantage plans and the Medicare program. Managed care leaders have tremendous opportunities to earn trust and reduce business risk. They can take meaningful actions to improve Medicare Advantage in the 3 areas I've just described, and making meaningful progress in these areas would ensure that Medicare Advantage delivers on its promise of well-managed care and costs, and it would be good business for plans. With over half of Medicare beneficiaries enrolled in managed care plans and annual expenditures of over $450 billion in scarce taxpayer funds, which, by the way, is enough to fund 160 trips to the moon, the stakes are very high. So long as significant gaps exist between the vision for managed care and the current reality on the ground, plans and their business partners can expect continued scrutiny and mounting distrust. Many aspects of the problems I've just described are fixable. As managed care leaders, you have the agency and you have the power to fix them, and resolute action would go a long way toward fortifying trust. The health of many of your companies is tied to the health of the Medicare Advantage program, by which I mean both the financial health of the program and how enrollees fare in the program. Prioritizing actions to enhance compliance can help improve and preserve the reputation of the Medicare Advantage program and Medicare Advantage plans. When it comes to reputation, to a large extent, you're in it together. The plans are in it together. We're all familiar with the proverb about bad apples tainting the whole barrel. Conduct by one plan can diminish the trust that Congress, the taxpayers, the providers, and that potential enrollees have in managed care as a worthy insurance model. Trustworthy conducts by plans can help tip the scale in the other direction. So what is OIG doing to support that vision for managed care? In addition to aggressively holding wrongdoers accountable, it is a core value of mine that OIG provide insights, tools, and support for those who want to do the right thing. I know that for Medicare Advantage to be successful, plans need to be successful too. So I'll highlight 3 ways we're working to help managed care succeed. First, we're prioritizing managed care and executing on a new strategic plan for oversight with 3 goals: promoting access for managed care enrollees, providing comprehensive financial oversight, and promoting data accuracy and data-driven decisions. I encourage you to read our strategic plan as it is a roadmap for where we're going. Second, we're continuing to collaborate with plans and our law enforcement partners to crack down on fraud that affects plans. Your partnership is crucial to identifying where fraud is happening. Third, we're providing compliance tools such as the toolkit for high-risk diagnoses codes. And last year, we also issued an updated general compliance program guidance, and it contains important information for compliance officers as well as for company leaders and boards of directors. We anticipate issuing a compliance guidance specific to managed care later this year. And we're developing this resource with input from a wide range of managed care stakeholders. And I want to thank RISE for helping us get the word out and all of those who have already provided input. So when we meet again in several years, I hope that our conversation will be about all that was done by plans and the government to close the gap between managed care as it is today in 2024 and managed care as it should be. I hope that we're talking about how patients, payers, and policymakers trust managed care to deliver high-value, cost-effective, patient-centered care. I hope we're talking about how managed care plans are excelling at managing costs by reining in wasteful spending, curating high-value care, and reducing administrative burden. And I hope we're talking about how profits in managed care derive from delivering an excellent product to patients and payers. And I truly hope that oversight of managed care is not a topmost priority for HHS-OIG. Managed care plans have a clear choice between perpetuating a problem-riddled system or building a better future for healthcare and for millions of seniors and people with disabilities. Plans do have a tremendous opportunity to bring the best thinking and promising innovations to the difficult problem of lowering costs and improving health. This is a call to service and a call for trust. Trust that plan benefits will be there when patients need them. Trust that plans will be good stewards of taxpayer funds, and trust that plans and their business partners will prioritize compliance and follow the rules. By bringing together key industry stakeholders and providing a platform to share important learnings, RISE is well positioned to promote trust in managed care and propel a robust culture of compliance. The agenda for this conference makes clear that RISE has its finger on the pulse of the most compelling issues, with important sessions on risk adjustment, quality, cybersecurity, and more. I thank you for your time this morning. I appreciate the invitation to share my thoughts with you again this year. I hope that you'll have an opportunity to attend the panel of OIG's top subject matter experts later this morning. They'll dive a little bit more deeply into some of our managed care work. I wish you a great stay in Nashville and a successful conference. Thank you.